So basically, we've decided that you're going to have a hysterectomy, and we just need to decide how we should do it, because there's different alternatives today. We could do a open abdominal hysterectomy, or we could do a laparoscopic hysterectomy. And now at St. Anthony's, we could also do a robotic assisted laparoscopic hysterectomy. And what that means for you is your recovery would be a lot shorter. Instead of a 4 to 6 weeks recovery, it would be a 2 to 3 weeks. Instead of being in the hospital for 2 to 3 days, it'll usually be less than 24 hours. Mm-hmm. And we can get you back to work, usually by 3 weeks, sometimes even sooner. But you might want to let work know that it's going to be about 3 weeks. Mm-hmm. And the advantage is it's a lot less blood loss to do it with the robotic-assisted laparoscopic surgery. Now, in your case, you are a candidate because the size of your uterus and the fact that you've had previous cesareans a year ago would have meant we should do an open procedure. But because we can use the robot with laparoscopy, I now can do it laparoscopically. I have much more control about taking down adhesions and freeing up the bladder, and previous scar tissue is not going to be a problem. In your age, I would really recommend that we keep the ovaries. Unless we get in and find that there's a surprise and there's endometriosis everywhere, or scar tissue precludes saving the ovaries, the consent form will say possible removal. However, I am recommending that you keep them because they'll be working for you for the next 15 to 20 years, and we don't want you to go into premature menopause due to surgical removal of ovaries. I also believe that you should keep your cervix. It's been a big controversy, if you've been on the internet, which I know you have lately, about taking the cervix or leaving the cervix. In your case, you've never had an abnormal pap smear, so you do have an option of keeping it. There's no medical indication on whether you should or you should not. It comes down to what your personal preference is. However, I guarantee if you have your cervix removed, you will never have a risk of cervical cancer in the future. And as you get older, the risk of cancer increases, and so your risk of cervical cancer would increase. So if we take your cervix out, you will never get cervical cancer. Now, I know your next question is going to be, well, then how come you don't just take my ovaries so I don't get ovarian cancer? Well, the reason is your ovaries are going to work for you for another 20 years and give you hormones and estrogen and protect your bones from osteoporosis. And I don't want you to go into menopause early. Your cervix is not going to protect you from menopause. Therefore, I would recommend we take the cervix but leave the ovaries. And we'll probably plan on sending you home after breakfast the day after surgery, as long as you're eating solid foods and no fevers. And you'll take it easy for the next couple of days after surgery at home. And I'll see you back in the office in 1 week, and plan on going back to work in 3.